Blog Talk Radio.
We interrupt this broadcast for an emergency announcement. A massive earthquake. The flood has reached. All roads into and out of are closed. No medical services. Store shelves have been stripped.
What's coming? Are you ready? You are at the right place to hear the best ways to stay safe and weather the coming storm. Welcome to Power Preppers. Here is your host, Patricia Baker.
Welcome, everyone, to another episode of Power Preppers. I am your host, Patricia Baker, and my mission is to make getting prepared for any emergency easy and efficient. So get healthy, get informed, get prepared. And please remember to sign up for our newsletter at supernaturalgirlswithaz.com for all the latest show information, discounts, and giveaways, both on Power Preppers and Supernatural Girls Radio. We've got some great discounts on products for you. We also do book giveaways, so make sure to sign up so you can be included for all this great stuff. We also have a Supernatural store, which has many lovely gifts, including a prosperity prayer in the ancient angelic language. Private readings are offered, new class on dreaming the impossible, returning to a state of grace. So check it out, supernaturalgirlswithaz.com. And this Saturday night, my co-host, Becky Andreasen, and I will be speaking with author Annie Kagan. Now, Annie is the author of a fascinating book. It's called The Afterlife of Billy Fingers, How My Bad Boy Brother Proved to Me There is Life After Death. Now, this is a true story. Annie's coming on the show to tell us all about what happened when her brother unexpectedly died and how he began contacting her from the other side. So be sure to join us. This is going to be a great show. But today, I am happy to tell you we've got a really important show, and it's about Obamacare. So with us to discuss this frightening topic is medical doctor Mark Davis. Now, Mark is the author of the book, it's got a great title, Obamacare, Dead on Arrival, A Prescription for Disaster. And Dr. Davis is a native of New York City. He's been a physician for the last 3 decades. And he also managed or owned health facilities. So that required him to interact with many levels of state and federal bureaucracies. So his set of experiences with government officials has provided him with some pretty expansive insights into the manner in which narrow-minded bureaucrats carry out legislative mandates, all to our detriment. So, Dr. Mark Davis, welcome to Power Preppers. Thank you so much
for having
coming
me,
on the show.
Patricia. We really appreciate being on your show.
Well, this is a great book. I read it, and I am so upset. I was upset before I read it. Now I know why I'm so upset. So there's so much
I think a lot of other people will be
cover.
upset after they hear this show, and they may not believe me, but the data is there with the references for people to see that they're not getting what they're paying for in Obamacare.
Well, that's for sure. Now, let's start at the beginning. How did you come to find out about what was in the works here? And your antenna must have gone way up when all of this first got started.
Yes, very much, very much. I graduated medical school from upstate New York in 1981. I went out. I was working in nursing homes for over a decade and then purchased some. I saw how the government came in with their surveyors and told us what temperature to set the thermometers at in each room, what to feed the patients. Not that we weren't intelligent enough to know what to do, when to turn the patient, how fast we have to give the medications, what the treatment plan should or should not be. So I started wondering, who are these people? Well, they were good nurses, probably good nurses in their field, who decided not to do nursing anymore, decided to direct physicians and my staff. And my staff, physicians alone, were in the hundreds. So I got to see how the government was coming in with their own treatment protocols, with their own diagnostic intense, things like that. And I started understanding where the government goes and how the government withholds money and pays you very slowly, and so the patients weren't getting the treatments that they needed. They weren't being paid to the level of care that the government was requiring us to have a certain number of RNs and LPNs and other kinds of people in the facility, but the government did not pay us to that level. So over the years, you get a good feel for how the government runs things, and they don't run them very well.
No, they certainly don't. That's obvious. And also, it sounds like what they were beginning to do at that time was coming in and placing themselves over and above what the doctor would want for the patient.
Exactly. What they did in the 1980s, Medicare had expanded over 20 years from its inception in 1965 to a point where they couldn't afford it. They just didn't have the money. So they started cutting back. But you, as the consumer, you didn't see that. What they did was they went behind the physicians. They had a quality panel empowered in every state through federal funds, quality review board, and they would go after the busiest physicians in every state. Those doctors that admitted the most patients to the hospital. Usually they're gatekeepers for insurance companies or HMOs, things. So a lot of patients would be channeled through them. So they went and they started directing the care, not while the patient was in the hospital. 3 months later, you would be told you didn't do a blood test. You let the patient out too early. You didn't have enough consultants. You did too many X-rays. You did too few X-rays. That is the flavor of how Medicare was able to intimidate physicians, especially busy doctors. And they were busy because people wanted to go to them. Why would they be busy otherwise? And,
right, they
and
must
so
have been
doctors
good
started coming. But the intent was not quality. The point was to cut back in the quantity. And that's where my interest really hit the ball. These are called these diagnostic-related groups. Example, let's say a patient 70. The government would say under Medicare, you're allowed 6 days in the hospital. Whether it took 2 years to get better, it didn't matter. I'm being facetious. But you will be paid for 6 days. Anything above that, the hospital and the doctor has to eat. So if a doctor had enough patients and stayed over the allotted time for that disease, they were considered an expensive doctor, and they would find themselves without hospital privileges or limited privileges. This is the way it was running down. But
wow.
Let's
See, a
drop
lot of
into
people
the
don't know that.
No,
the
not
doctors
at all.
were
They didn't know it at all.
mandated in this way.
We were being harassed. We were being direct. And I was a new guy on the block. I really didn't understand what was happening here. And I graduated near the top of my class. I think it was 1 more, 2 more, whatever. I thought I knew something. I was dumb. I was not initiated in the legal aspects and the political aspects of medical care. I was in the public health service for a while. I served my time there. So I didn't understand where it was good. So I come to Maryland to serve my public health service. I'm seeing 60 patients a day. They don't have anybody else. I'm seeing soldiers and people that really needed care. These are great guys. They put their time in. I was their doctor, okay? So I was seeing these patients, and okay.
60 patients a day, though,
yes,
Mark?
We
That's
work
huge.
Yes, we work 12
huge
and 15-hour shifts. We didn't work 3-hour shifts. These are long shifts. Okay, sometimes we work 24-hour shift on, 24-hour shift off. It depended on the week. So you can see a lot more than 60. Some were cuts and bruises. Others were chemotherapy rejections. Others were abuse, things like that. But we saw a lot of. So when you get out in practice, when you all of a sudden you're seeing the same number of patients, even less, you're considered a very busy doctor. So you're categorized now by Medicare, medical assistance, Blue Cross. This is a busy doctor, and he does not fall into the paradigm, the model. They have a magical model of a doctor who should only be seeing 25 patients a day and have 5 people in the hospital. That's a big joke, especially when you're running nursing homes and you have 3 or 4 doctors, but one doctor's name goes on the billing, and with 50 patients in 4 hospitals, as an example. Lots of doctors taking care of them. Not the only, but
so
that's
they're trying to put a square peg in a round hole and make it work, and then all you guys have to fall into line.
Right. We were intimidated. One of the best nephrologists, kidney doctors in the state, was the head doctor of his group. He had like 8-10 doctors on it, but he was the doctor whose the billing went out under, the name went out. So he was considered one of the highest paid medical assistance doctors in the state of Maryland. His name was in the front page of the newspaper. I'm not joking. This is how doctors are being intimidated. Now let's jump to 1990s. Get away from that for a minute. In 1993, Hillary Clinton, bless her heart there, was trying to make a health plan similar to Obamacare. But it was being done behind closed doors with few, if any, health care input from people like myself, more politicians and lawyers. We found out about it through Freedom of Information Act, and that was pretty hard to get those through. We found that there were more penalties and sanctions in Hillary Care than there were health care initiatives. It sounds very familiar because it's the same thing that's in Obamacare. More
right.
penalties and sanctions. Well, see, that fell apart very quickly, and they quietly buried that. Let's jump forward now. Hillary Clinton is working for Obama. Okay. All of a sudden we have Obamacare now. That started in 2008, all the researchers. The final bill that culminated of 2 years of, it was written by lawyers end to end, was Bill 3590 from the legislator at that time. That was the final bill that was passed into law on March 23rd, 2010. That contained, you'd have unlimited care, all pre-existing conditions will be wiped away so you can get in to have insurance, unlimited diagnostic, unlimited therapeutics, unlimited pharmaceuticals, et cetera, et cetera. That turned out to be one of the biggest lies in the history of healthcare in America.
And we're all just starting to find this out. I mean, you know, somebody said a while back that Obamacare was really just a big tax bill.
I knew because of people like yourself came to me and said, Mark, they're paying a third of my health care. I did a lot of geriatric. I'm there. I'm seeing a gastrostomy tube being put in, but they're paying 10 cents on the dollar. I see patients not being covered at all. I had one Afro-American patient, one of the nicest guys you could ever meet, needed a blood transfusion. I did the blood transfusion for him. We had to keep him an extra day because there was a reaction to the blood just to keep him over. They denied that extra day, which was $1,000 because he was in an intensive care unit. We had to take this guy in a wheelchair to a Medicare court to fight this one day. It's $1,000. I said, I'll do it. Okay, what do I? So I took the family. The family understood. We went up there. The judge took one look at him and gave him that one day. He may have given him 3 or 4 more days, for all I know. But he gave him that one day. But that's what we're up against. Unseen, unheard bureaucrats reviewing records without seeing the patient, making judgment calls. These are non-elected officials. Most of them are not even in the medical field. And those are the people who will be pulling the strings, just like in Obamacare. The bureaucracy is huge, $10 billion a year, just to run a bureaucracy. You heard of navigators, haven't you? Have you heard of the navigators in Obamacare? These are people that go out and explain. These are people that are hired off the street, literally off the street, without any medical experience, pay $30 to $35 an hour to go explain to people on the projects or in the inner cities or in the outskirts of a town or whatever what Obamacare is all about, and you should sign up because it most likely is free for you. So they're being paid all this money. Well, we found a lot of fraud in that, and people were being arrested. Many of these were criminals that they signed up to be navigators.
Lovely.
They were being paid. They were being reimbursed more than the doctors that are treating the patients. I'm not joking. This is a real.
There is something so wrong with this.
Well,
there is
of course
something
it is,
so wrong with it.
That's just the tip of the iceberg. Phase 1, you know phase 1, right? Exchanges.
Yes.
Everybody, just for your audience, the exchange is a place where insurance companies go online to compete against each other to get your dollar. So you could buy insurance online. That's basically what it was. So there was no public option. The only thing that we really needed out of Obamacare was a public option. There isn't any. That's the amazing part. So
the one thing we really need, it's not there.
Right, but it's not finished. You have to ask yourself, what are you exchanging your money for? Are you getting anything better on the exchange than you would with a traditional policy? And the answer, as we know now, no. You're going to pay more for less. And if you didn't get the insurance, because people are registering, paying their money, they're putting all kinds of information into this computer, well beyond what is needed to purchase health care. You're putting your criminal record in, your driving record, whatever they're asking for on there. It goes into a computer bank. And then maybe you get your insurance. And why do I say maybe? Because sometimes the insurance company is not communicating with the site you're on. So you have to go behind the site, call the insurance company, and make sure you really have insurance. Because you're just not getting any kind of sampling back. They're not getting any reverberations back from the insurance company on the line itself. So they told us to tell the patients, make sure you call the insurance company to see if you're insured. How do we know this now? In 2014, there was a lady with a very bad breast cancer at Sloan Kettering Cancer Hospital in New York. She found out a transition after January 1st, 2014. Her doctors are no longer covered under her plan. They eliminated a group of doctors, so she needed to get other doctors. But meanwhile, her surgery had to be canceled. She had a very aggressive surgery. So we're seeing that now. Another small ramification that may kill a patient. Remember, the cover of the book has it has a
and
cemetery.
then in your book, you have a whole chapter on this,
right.
on the waiting game,
That's
and
right.
how that is going to start kicking in very soon.
The headstones, it has a cemetery with headstones saying victim of Obamacare. And I'm not kidding. I've seen people die because they didn't have access to health care in the right time. We should have concentrated on the people that needed the health care most, not the people, the 85% pre-2010 March, that already had it. But we didn't do that. Obamacare wants to turn over all the insurance. So there's a lot to be said about these things, and as we go through, of course, we'll talk about it.
And let me ask you, Mark, now, what do you I mean, you're obviously very educated in many things, not just as a doctor, but you're educated now about the political field. What do you think the real reason for Obamacare's existence is? What's the real purpose of this? It's definitely not to improve medical care.
There's a lot of money in health care, tons and tons of money out there, good, bad, whatever. The end point was to get rid of all the insurance companies selling insurance, to make it a one-payer system. This was already stated by Harry Reid. People can Google this. So you'd have the government controlling approximately one-sixth of the economy that they don't control right now. And that was the end point. We're using the insurance companies to administer the monies coming out of Washington, not insuring people. So the government would have an insurance policy. You'd buy a one policy fits all for people, like a glove that fits everybody. That's what the intent was, pretty much. So your dollar goes to Washington, and they come back and tell you, this is what you could have, this is what you can't have. And it's full control for them. That's what they're trying to do. Like the National Health Service, that's an example, which allows private practice now anyway. Same with Canada. Canada initially did not allow private practice. Now they do because they can't manage all the people in the country under their health system. So whatever is going to happen to Obamacare, it's going to have to be modulated in such a way that's more palatable to the people. Otherwise, it will implode, and we can get into that too if you'd like.
Yeah, I mean, this is a very scary situation, I think, for everybody in this country. It is socialized medicine. And if we look at other countries, we don't see that working very well, do we?
No. I did a show today out of Britain, but actually it's on both sides of the Atlantic. We were discussing the National Health Service. They have a protocol called the Liverpool Protocol, which allowed hospitals to put people on do not resuscitate list, even if they're viable. There was a major scandal about this, and then it was quietly settled down. The doctor that put it out there, we cannot find him, whatever they did to him. So I think these type of protocols will be put here in this country as well. After you've put in your 70, they will tenor down the amount of health care you do get there, and they're already trying to do that. As an example, in the last month and a half, 2 studies magically emanated from quasi-government sources, one about hypertension, how we should modulate our treatments for hypertension in people over 60, and another one about how much we should aggressively treat people with high cholesterol. Maybe we shouldn't treat this level as aggressively as not. The idea is there's a biological value in people, and as you get older, theoretically, you don't put in as much to society as you would have if you were younger. You're not paying in, you're taking out. So looking at it at a Machiavellian way, what's better for the government is people just die off, and that's basically what they're looking for. So there's no death panel. You just get less care, ration care. You get end-of-life discussions, consultations, things like that. Maybe you shouldn't be resuscitated, even though you may have another 5 years in you. If you get sick, let yourself go. That is the intent. That's where they're going with this. This behemoth, this monster Obamacare, will never survive if they're going to provide everything that they initially promised. and they can't, and they know that now, and that's why all the executive orders are coming down to delay it and keep delaying it until it becomes palatable to the society. You may have heard Obama on the State of the Disunion speech, and the State of the Union speech.
I couldn't stand to watch it, quite honestly.
Well, I wrote an article the other day. If people want to read it, the State of this Union speech, more of the same, which is all over the Internet now. And I would tell you something. He lied about the number of people that have signed up. He lied about the content of the type of people that have signed up for this behemoth, about the care given, and he says that the Republicans have not offered any alternatives. That is a complete and utter lie. Republicans, both in the House and the Senate, have offered hundreds of proposals of different things to either amend it or remove it, and he has not acted on one of those. So that was the lie. He says there are 3 million people signed up. No one can verify that, but a lot of people were shunted off of medical assistance, a government subsistence program, into another government subsidy program on the exchange. So basically there's no money being generated. The algorithm for Obamacare, according to Ezekiel Emanuel, who's one of the architects of, if people don't know who he is, he's an MD, PhD, the brother of Ron Emanuel, the mayor of Chicago, left as you can get. I think his PhD is in political philosophy. I don't know what political philosophy. I know it's not democracy. And he said we need 7 million young people to sign up to pay for the people on the other end of the age spectrum. So that algorithm, as it stands now, does not work. The formula for Obamacare will implode based on his own words. So I don't care how intellectually flavored this guy is. He doesn't know his math. And if
Apparently
he does,
not.
If he does, he's not telling us the absolute what's coming down the pike.
It doesn't even make any sense to expect 7 million young, healthy people to sign up for this. They are also allowed to stay on their parents' insurance until they're 26 years old. Yeah. So, I mean, where are they supposed to get these people from?
Yeah, but you mentioned that was a very good observation. The great contradiction is Obama goes to the colleges. He encourages people to sign up, these kids, 18, 20, like they have any money anyway. They're all borrowing money.
Yeah, right.
50% of kids borrow money. And they could stay on mommy and daddy's plan. So that's the major contradiction. And so that's not going to happen. The other thing is, if you don't sign up and you're of a certain age, you only pay less than $100 penalty if it's an individual policy, which cannot even be enforced by the government. There's no teeth in it. It goes on your income tax, so what? But they can't lien you. They can't take anything away from you. Not till another executive order comes down the pike, which it will if we allow this thing to keep going. So
how do you fight this, though, Mark? I mean, this thing is so big.
Well, this is a great question. This is asking me all the time. I would tell you this, and I really sincerely mean it. If the physicians were cohesive as a group, which they're not, they could stop this in 24 hours. They won't do it because too many people are on the take from too many different areas getting money, and they're worried they'll have their licenses revoked. With this new stuff with the security and the NSA and phones being bugged and whatever. There's a general level of hysteria in the United States right now. People are worried about so many different things, and the government keeps increasing the turmoil every day with a new release of information about what the government is doing to people or not doing to people. And what they do is to scare you even more, and this has been done through history. If you look back in history, they'll select out a few people and they'll go after them. All right. For example, the Virginia governor, I think it's McDonald, is that his name? He was indicted for taking stuff, and he should have done it. Okay, we agree. But if it was a Democratic governor in there, nothing would have happened to him. They would have turned his head. They're going off to Chris Christie. Whether you like him or not is irrelevant. They're trying to destroy his career to get Hillary Clinton in. So they're going after Republicans because they just indicted the guy that did the Obama 2016 movie. He's indicted, and so forth. Anybody who's telling anything about the country in any which way, or anybody who's going to challenge the democracy as Obama sees it, will have his head wrapped up. And that's what they're doing. They scare people. That's what they do to physicians. They scare them. You get several
letters
from the medical
board. So they're using
board.
scare tactics on physicians, and so that prevents them from all coming together as a group and shutting this thing down.
Right. Yeah. Look at this. In Maryland, we can talk about Maryland. It has a medical board of 21 people. Guess how many of those are doctors? 8 people are non-physicians. They are political appointees. Okay. So how can you have an expert medical board with 8 non-physicians on there? It doesn't make any sense. This is the same board now, but the law board is 85% lawyers. Okay, why don't we have 40% of their board as civil people in the civil area overseeing it? We don't have that.
Yeah, just civilians who don't really know much.
That's right.
Sure, let's put
exactly
them on the board. Yeah, exactly.
But if you're a doctor who has a family and an $80,000 year malpractice bill and 16 people working for you in the office and all this, you have to pull down $500,000 just to break even in a lot of cases. In the book itself, it talks about a neurosurgeon. I won't embarrass him on here, but I'll tell you, he talks about how long it takes to become a neurosurgeon. And if you want to become a neurosurgeon with a back subspecialty, it takes even longer. So you're starting in regular college at 18. You don't finish till you're 33. He gets 20 years maybe to earn his living. And then he comes out and he's hit with a $150,000 a year malpractice bill. And they're sued very, very heavily. So you're going to see a dearth of specialists coming down the pike. And that's what we're seeing right now.
Well, and, when I spoke to one of the doctors I know about this who's totally against this whole thing, he said you're going to just see a doctor shortage because many of the doctors that are his age, and he's in his 60s, he says, I'm just going to retire. I'm not going to deal with this. So we're going to see a lot of specialists leaving.
Speak out. The doctors are not speaking out. If you turn Fox on, you turn CNN on, you turn left or right on, it doesn't matter. They're bringing in politicians. They're bringing in lawyers. They're bringing people from the Heritage Foundation. I think there's one physician on that of the 100 on the list from the Heritage. They're all lawyers. Lawyers wrote Obamacare end to end and side to side. They're the ones who are going to benefit hugely. It's like fantasy land for them. There's so many different ways they could sue in that bill. It's just mind-boggling to speak about it. Physicians are not, in general, speaking out against Obamacare, and they should be. Ben Carson came out against Obamacare. I don't know if you know who Ben Carson is.
Oh, Ben's wonderful, yes.
To a point. Okay, I agree with you. Brilliant surgeon, great historical, how he came up, that kind of thing. But where was he prior to 2010 when Obamacare was being formed? Where was he when it passed? Where was he between 2010, March 23rd, and the election in 2000?
Yeah, where was he?
He was nowhere. He was he didn't mention a word about it. Now that he's retired from Johns Hopkins, all of a sudden he's mentioned, you know why? Because Johns Hopkins gets a huge amount of money from Obamacare, Medicare, and medical assistance, both state and federal levels. And it was disadvantageous for him to open his mouth because he gets money. That's how he was paid. So now that he's free of the reins from the hospital, he's all of a sudden against Obamacare. Right in front of Obama, he said something like that. Then he said his taxes. Yes. Then he said his taxes were audited. Now, come on, It's mind-boggling. I've written some stuff about this, and I said, where were you? You could have said something and help stop it in its tracks. Where is AARP? AARP was initially against it. When they found out that they're going to benefit financially from it, hugely, they're all for it. The hierarchy of the AMA, where were they? They're all for it, and more than 70% of the people under them, the doctors, are against it. So it doesn't make any sense. By the way, with the AMA, they only represent 1/3 of the doctors in the country. There's 900,000 approximately. Yes, that's correct. So 1/3 of the doctors and 70% of those doctors were against it. Their own hierarchy went for it. I assume they have some advantageous, maybe financially, or some other way they're getting their money. So it's all about money. It's all about shuffling money.
It is, unfortunately, and that's why this is all something that really needs to go away, but it doesn't sound like it's going to go away anytime soon. Mark, hang on just for a few minutes. We're going to take a short commercial break, and then we're going to come back and continue this very important conversation. Okay. So everybody stay tuned. If you have a question for Dr. Davis, you can call in at 646-478-0828. Stay tuned, everybody.
Bonjour, this is Veronique Raskin, founder of the Organic Wine Company. As one of the pioneers of the organic wine movement, since 1980, I have brought you the very best and most authentic organic wines directly to your table. I work with small family estates who grow certified organic grapes and produce exceptional wines. You can purchase our wines individually from our website at theorganicwinecompany.com or join one of our wine clubs. Our organic wines are perfect for you and for your family as gifts for friends and relatives, and they are simply spectacular for the holidays. Visit us at theorganicwinecompany.com to enjoy the very best organic wines conveniently delivered to your door. I am Veronique Raskin, passionate about my mission. I offer to you vegan, organic, and biodynamic wines made by people of the heart, wines with a heart. Au revoir. Call us at 1-888-ECO-WINE.
Are you ready for a new experience of freedom and powerful connection? Would you like a positive, effortless change in your life? Then come to CosmicFusion.com, where we offer the most advanced energy clearing and expansion techniques in the world, with a quantum vortex energy to activate your divine blueprint and life's purpose. When your soul leads the way with cosmic fusion and quantum vortex energy, you can break clear of past difficulties and blocks with the power of the source. With cosmic fusion, the source energy does the work for you. It's easy and effortless. Listen to our free meditation right from our Cosmic Fusion website, the Cosmic Code Meditation. Sign up for one of our interactive webinars today. Come to Cosmic Fusion, www.KOSMICfusion.com, to experience an effortless awakening and transformation. Are you ready for an upgrade? Are you ready for a new experience of living in the fifth dimensional magic and powerful connection? Then visit CosmicFusion.com today. CosmicFusion.com.
Your property tax bill. Have you seen it lately? It's frightening. Your property taxes are going up while your home value is going down. It's time to fight back and win. For the real truth about the property tax system, get attorney Pat Quintilian's book, Are You Getting Screwed on Your Property Taxes? How to Find Out and How to Fix It. Attorney Quintilian answers all your questions and gives you the facts you need to fight a property tax bill that is spiraling out of control. You'll also read about what happens to property owners who don't check their property records, only to find out too late they're taxed on square footage, fixtures, and even buildings that they don't own. Is this happening to you? Learn your rights. Buy attorney Pat Quintilian's book today. Are You Getting Screwed on Your Property Taxes? How to Find Out and How to Fix It. Available on Amazon.com.
Welcome back, everybody. We are speaking with Dr. Mark Davis, and Dr. Davis is the author of a great book entitled Obamacare, Dead on Arrival, A Prescription for Disaster, and that book is available on Amazon.com. I highly, highly recommend it. So, Mark, welcome back to the show.
Thanks, Pritch. I really appreciate it.
Well, here we are talking about these things that have befallen the people in the United States and how physicians have been scared silent about it. And what about the rest of us? Is there anything we can do as civilians about this?
Yes, learn as much as you can about it. There are many great summaries online. If you don't read my book, read as much as you can. Keep your traditional policy if at all possible. I would stay away from the exchanges the best you can. When you go to the exchange, they ask for too much information that is not the government's business, and you shouldn't be going on there. Now, a lot of people in the audience may be forced on those exchanges, but if you can get traditional insurance, you may even get a better deal. There are still some companies out there that are offering good deals. I would be very careful about the catastrophic health insurance and that people are offering. I heard it on Sean Hannity. To get catastrophic, it's very expensive and it doesn't cover that much as he may think it does. So then there's medical savings accounts people could have. So basically, you could pay your own way if you just want to pay the fine to Obamacare. That's fine, but you can buy your own insurance. So that, but knowing as much as you can, that's one thing. The other thing is preventative medicine. I wrote a book called The Millennium Diet, but there's many good diet books out there. Watch what you're eating. If you're overweight, try to reduce some weight. If you're unexercised, I would start exercising. As much as vitamins and antioxidants have been villainized, I would take them. I think they work. over a long-term period of time. So there are things that you can do to prevent a lot of diseases that we have. Approximately 50% of diseases are iatrogenic, meaning self-generated in one form or another, not genetic. Most diabetes is type 2 diabetes. That most likely you brought on yourself, and or mom had it because she was heavy as well. So
these are lifestyle choices.
Yeah,
and
lifestyle choices.
That's within our hands to make better choices so that we don't need all this medical care.
That's correct. I would stay away from nicotine. It's a killer. I could see my own brother-in-law died about 11 weeks from diagnosis to death, stage 4 cancer.
Wow.
I've seen a lot of cancer out there. I don't care what they say about it. There's less cancer out there. There's more cancer out there. I see people dying of pancreatic cancer, all kinds of stuff. And I'm not trying to make people afraid. We could stop a lot of the cancer by our lifestyle and what we do. So nicotine, alcohol in moderation, please. You don't need to have a bottle a day. Have a wine, enjoy it, but not so much. So it's embedded in the Millennium Diet book. There are good books out there for lifestyle and diet, and I would pick up one at the library. Go up there and see what you can get. So there are
That's
things
great
you
advice,
can do.
Mark.
Yeah.
It's great advice because
things.
so much of our health is really in our own hands and the choices that we make every single day and what we're putting in our mouths. So, or sitting on our behinds when we should be doing some exercise during the day. So all of this does make a huge difference, and it's something we talk about on the show all the time, about healthy products, healthy food, vegetables and fruits, things like that. It makes such a big difference. And
huge. People will live longer. We know now that people can live longer by choice of diet. How do we know this? We take animals, lab animals, have similar physiologies to our own. We put them on a high-protein, restricted-calorie diet, and in many instances they live longer than their litter mates, up to 100%. I have a page in the book, and also it's in the Millennium Diet book, but also you could just Google this stuff. It's out there. Longevity through diet really exists, and don't believe that they say vitamins don't work. It's a small study, and the way it was written, it's very questionable. It just came out, I guess, 2 or 3 weeks ago. I don't believe a word of it.
I don't either. I think it's
the medical profession's been after vitamins for years and years, not to take them, and that's just not the way it goes. You need to take them for long term. I've been taking them since medical school. I'm fine. I'm 62, but I look 61.
I think that
I'm just joking.
Well, see, you're still alive. There's a good reason to really research all of this because, again, you empower yourself. When you learn about these vitamins, when you learn about herbs, when you learn about proper diet, it just makes a huge difference. Instead of you going to the doctor and expecting the doctor to give you a pill, you can make the same poor lifestyle choices you've been making for most of your life. I mean,
at the
crazy.
The turn of the 20th century, a male lived to be about 46 and a female about 46.6 years. Now look at us, people living in their 80s, skiing, swimming, riding bike stuff like that. Katharine Hepburn used to ride. I went to some of my schooling in New York City. She used to ride a bike down Park Avenue till her late 70s when she had a hip fracture. So it's a brand new world, but the biological limit for people right now is 120 years. If you don't have any catastrophic illnesses and things like that, no one has reached that yet, or that not even close to it. But we're getting there, and I think by the time the 21st century comes around, you'll see a lot of centenarians, people living well over 100.
Well, if this health policy doesn't kill us off, I mean, because, again, if you do need care, emergency care or something like that, there is a good chance, from what I've read in your book here, that you could be waiting so long that you end up dying because you're not getting the care you need in an emergency situation.
Correct. What happens is, in order for Obamacare to work, they have to ration it somehow. So doctors will have their fees bundled. That's one way they're going to do it. A bundle is, doctor used to get a direct payment from Medicare Medical Assistance Insurance Company. No longer, as Obamacare is implemented after January 2014, fees will be bundled. The hospital will get a fee. They'll cut it down and give you a portion of that. And it may not be what you've gotten in the past, and I would assume that's happening. We don't know the numbers correctly at this point in time, so I can't give you a solid number on that. But if there are gatekeepers, if you are forced to go see a family doctor and you have to wait 4, 5, 6 weeks to get into a family doctor, and you have a very bad disease, that delays treatment very much. That's what happened in Canada. Canada had a lot of problems. The patients would wait 2, 3 months to get in. It's in the book with references. So you have to get in to see your physician quickly. The other thing they're going to do is for cancer patients specifically, you cannot get to see your cancer specialist until you get through the primary gatekeeper, if we'll even send you to the... They have the ability to give you the new drugs. They know about the new drugs, and many of those drugs will not exist because money's been shifted away from research under Obamacare as well. So there's a lot of facets to Obamacare that people haven't seen.
Yeah, and it sounds like it's just going to decimate our healthcare system so that we're not going to get anywhere near the service level that we would expect and the care we would expect in any situation, whether it be emergency or chronic illness.
You're in Massachusetts, as you may be aware. Many doctors, especially in Western Mass, close their practices to new patients when Obamacare first came out.
They absolutely did.
Yeah, more people coming into the system, and reimbursements aren't that high, and they say, well, we can't handle it. There's only so much you want to do. There's only so much you want to work. And they have a life too. No one said we have to work 24 hours a day. Where did that come about?
Exactly.
The doctor has to work. That we can't have a vacation. We can't make a decent living. I don't understand. It's like a star, an actor could make $100 million a year, and that's wonderful. If a doctor makes a couple $100,000 a year, he's evil. He's nasty. He's stealing. I've heard that so much, I get sick of it.
I bet you do. I think it's
the politicians
so...
we were reimbursing our politicians that much money.
Well, now they're calling Congress the Millionaires Club because almost, I don't know, I think it's about 3/4 or more are millionaires.
You just hit a bad point here. I wrote Demons of Democracy, how lawyers and legislators are undermining every institution and tradition in the country. They go in, they don't have any money, and they're coming out multimillionaires. How does that work?
Exactly. Yeah. How does that work?
From?
This is, again, but I want to get back to this Obamacare thing because I have a question. Does this benefit anybody?
Yeah, it does. It does. Yeah, yes. I have to be balanced here, of course. People that don't have access to insurance right now will be benefited by it. If they can't afford it or for some reason they just couldn't get insurance. Yes, it will benefit a subsegment of the American society. How many? We don't know exactly. Let's look at it like this. 85% of the people had some access, some way traditional or public insurance prior to Obamacare coming on board. There were 15% of the people that didn't have it. Those 15% of the people may benefit by it. If they're poor, they'll get a freebie. If they're illegal in the country, they're going to get a freebie. If they're young and they didn't want the policy that they want to go in and they just don't have enough money, they will get a freebie or reduced costs. So there are those people that will benefit. People that have existing conditions that supposedly will be covered are supposed to be covered, but I don't believe in all cases they will be helped by it to a certain point. But it's a small percentage of the entire American population, which is teetering about 316 million people right now. So there are some benefits in there. What they say, unlimited pharmaceutical care, diagnostics, that's not going to happen at all. Unlimited access, no, not at all. And of course, there's no parity. There's no. It gives it. The insurance is tiered. Bronze, gold, platinum. So there's no real equity between the insurance policies. You were supposed to have equal insurance. The poor person and the rich person were supposed to have the same thing. We both know that's ridiculous, but that's what they're supposed to do with Obamacare. Give everybody some ability to have access to insurance to certain levels, and those levels will never get to the B because it's so complex and intricate. I believe it's going to implode. I think the algorithm is such that the formula is just not going to work, and you'll see it in the next year or two. It'll decimate itself under its own weight.
Well, I think that's a very strong probability, and especially given what you have researched and uncovered in your book, which again the name of the book is Obamacare: Dead on Arrival, A Prescription for Disaster. Now, you also mentioned Romneycare, and since I am here in Massachusetts, one of the things you and I were discussing before the show is these people that do get these subsidies and how what we've witnessed here is people importing their family members or other people from other states to come here and get free medical care.
Yes.
Now, I'm saying free in quotes because clearly the rest of us are all paying for this.
Yes. Yes, they are.
And it's expensive for the rest of us that are here under Romney Care.
Well, I wrote that people were coming in from other countries and getting free care. They just brought in a month or two, people coming in from other states and getting care. And they were supposed to correct that. Apparently, to your knowledge, they haven't corrected that yet.
No, they have not.
You'd have to establish residency for at least a year. I
no,
make it
that's
2 years.
not happening.
But that's what's happened. But basically, if you come into Maryland and you want to be on medical assistance, there's no real established time period you have to be here. I checked with the local and regional health departments here in the state, and they could not give me a number. So people that walk in there get insurance. You want to hear something that makes you really sick?
Oh, I can't
people
wait.
People come in here with Mercedes-Benzes, BMWs, whatever. They have medical assistance cards. They live in $400,000 houses. How do we know? We're all neighbors around here. I don't live in a house like that. I live in a perfectly middle-class house with a couple of floors and a few bathrooms. People are living well above their means, yet they're not making the money to that level. They're getting freebies. We've had people come into the area. My son built a house. He had to wait 4 or 5 years to even get the down payment together. You're seeing people come in and buying homes on a government dime next door to him. Okay, how, where? I don't know these programs. I haven't researched it.
I don't know how to work the system like that, so I don't know.
They are working the system. If you go to the disability offices here, by and large, people are less than 50 years of age getting disability. Social Security disability is a big sham. 15 million people are on Social Security disability, and how many of those are real disabilities? We don't know. We have no idea. Why? Because the definition of disability has been expanded to 1,000 different diagnoses. And if you go online, you can see them. It's unbelievable.
So let me just give you another story about this is exactly what's going on here in the state and across the country, apparently, because it's happening there in Maryland as well. Yeah. I did hear a story that I was able to verify of a couple that came here from another country, and the wife had a heart issue. She received open heart surgery, and all of her expenses were completely covered. And after that, she was paid and continues to be paid a monthly, I don't know what to call it. It's not disability, but it's like something like that. And it's more money than I could get today for myself if I had to from Social Security. So I don't want to see people go without health care. However, I find it troubling that people can come here and get the subsidies for new homes, and I watch my friends who are working, like your son works, to get their down payment together, and then somebody comes in from somewhere else, they get all of these things covered for them, and it then becomes this entitlement issue for a lot of these people, and we're losing in a major way.
That's the mentality, though. The entitlement mentality says that I owe them something. I owe them something because of where they come from, something in the past that generated that entitlement. And I argue in the book, medical care is a necessity, no doubt. No one could argue that. Whether it's a right, there's nowhere in the Constitution, nowhere in the pre-Constitution that I researched, in the Federalist Papers or even prior to that we could come up or generate a right that the founders had for health care. Now, we didn't have health insurance back then, but it doesn't even tangentially touch anything in those areas. So where does it come all of a sudden? It went from charity to welfare to entitlement. Now it's a right. Well, who generates that stuff? So basically we're living under a number of falsehoods. Obamacare is now considered a right. Who or what basis are they using to say that? We don't know. Nancy Pelosi hasn't told us. Harry Reid. We didn't hear from Governor Romney at the time when they were generating Romney Care. So there's a lot of quasi stuff going on out there. I cover some of it in the book just to give people an idea.
Yes, it is covered, and I read it, and it is, again, it's very troubling that this has gotten as far as it's gotten. And it's, again, you look around and say, what is this ultimately creating? It's not a pleasant picture at all.
This is what Aldous Huxley wrote in Brave New World. This is Brave New World. It's a world of non-working people. The government supplies whatever they need, whenever they need it. A Machiavellian look at the society, where we're going to give you so much for so long, then we cut you off at the end, and you just go on to your separate way. Do you remember a movie called Logan's Run?
Yes.
Where Michael York and Jenny Argota, they weren't allowed to live past 30.
That's right.
As a form of eugenics, where they had to go through the carousel to relive, and they never got to relive. Then they found out there were actually old people in the world. What we're looking at may be the prelude to some kind of euthanasia or death panel, as Sarah Palin said in 2009. We don't have that in writing, but the rationing looks like that when you're generating studies that are anti-old people, anti-geriatric people, and now people 75 years old, they're out riding bikes and playing balls, we talked about. So it's a whole new world, but Obamacare doesn't grasp that in its concept, meaning, or way it's being carried out right now. Now, it took 3.5 years to get the exchanges online, and they messed that up completely, both at the state and federal level. As of January 1st, 2014... Let me also bring this
point up, too, Mark, because in your book you bring up the American Journal of Medicine study that was published in March 2011, and the title of it was Medical Bankruptcy in Massachusetts. Has health reform made a difference? Can you share with us about that study? I mean, that's kind of important.
Yeah, they didn't go bankrupt yet, but they were putting in more money. The government had to pour more money into the program than the program was generating. So at some end point, according to the study, the system has to collapse. They have to either gather more money, keep raising fees for the public, or, the end point, the system fails. That's what the study says, okay? And the same thing with Obamacare. There's not enough money coming in. The algorithm, the formula says we need 7 million young people to pay in by mid-March of 2014. You're not even a quarter of the way there in terms of the absolute number of young people to get into that.
How many
system.
people, do you know, does anybody know, how many people have actually, what the true number is, how many people have signed up for this thing?
We know, as what the government has told us, that 3 million people have signed up. But of that 3 million people, how many were transferred over from a freebie like medical assistance to a freebie under the exchange? We don't know. Obama says millions of young people have signed up, but they could all be medical assistants for all we know. We just don't have the facts and the figures to go with it. Here in Maryland, it's a joke how many, tens of thousands of people, most of them were on assistance before, as the information is flowing out to us. So we cannot give you solidified numbers right now because they just don't exist.
And that's another problem. I mean, there should be solid numbers. There should be something that we can rely on, and there's nothing. Well,
we have a translucent or opaque government. We don't have a transparent government, as was promised to us, and we know the rest of the story. I'm curious, though, I haven't talked to anybody from Mass General recently, how they're taking it up there, because they get a lot of money from the government. They've been very, very quiet. The big institutions with all the brilliant doctors have not said anything. I haven't heard anything from these people at all. Have you heard anything locally?
I have not. I just, again, what I hear are the people that are working and that have to pay for their own health insurance or are working for a company, and their rates have, again, gone up exponentially every year. They are disgusted and disheartened by the burden that has been placed on them to pay for everybody else who doesn't feel like working. And, I mean, I can tell you, there was a guy that just moved here. He had a small trust fund. He exhausted it, and he needs medical care, so he moved here. And now he'll get all of the benefits, welfare, food stamps, and health care.
In your state, in the Bay State.
Who's paying for this? It's all the people that are working.
The insurance companies asked for increases in 2010. The state said no. They're artificially keeping the price of the insurance low at that point in time when they needed to raise it because so many people have come into the system. The insurance companies needed more money. So eventually something has to give in the financial areas, and I think it'll implode. But Obamacare is a microcosm of Obamacare. They may be able to manage it at the local level a lot better than at the national level. So you may have Obamacare for a long, long time.
Unfortunately, it seems that way. We're kind of stuck with it. But again, I see these insurance rates; they're going up every year. I mean, it's a huge amount of money for an individual. If an individual, for example, who wants a Blue Cross Blue Shield policy with maybe a $2,000 deductible or something like that, they're going to be paying upwards of $700 a month to get that.
That's for somebody probably under 40 years of age, maybe. You know, because here in Maryland that would happen. We'd have a $6,000 deductible, and your price would be about $400 a month. So that's what you see, and that would be through your employer, which is a group plan. So the fees are outrageous. State per state, you cannot match them at all. Connecticut, prior to Obamacare, they raised Blue Cross up, I think it was 30%, before it was signed into law. So they were getting ready for it, and they knew better probably. They had a soothsayer working for them there. That's for the omens.
Well, somebody was logical who knew what was coming down the road.
Somebody who was very smart. Blue Cross. If you had a Blue Cross plan in 1970s, the doctor would bow down to you. It paid everything. There was no half a pay or quarter pay. When my mother was sick, bless her, she passed away from cancer. It paid everything at Columbia Presbyterian in New York. Nothing. We didn't get a bill. It paid for my kids' birth and stuff. Nowadays, it's a big joke. We got a payment of $1 one time for something we did here in the office. $1. Why even waste its stamp? It's a 40+ cent stamp. It doesn't make any sense anymore. Anything that's happening.
Well, it really doesn't, and it sounds like if this thing does move forward, and then medical care will suffer as a result. We who need medical care will suffer and possibly die from this. So it's really not, again, this is not a bill that's created to increase and improve medical care. It really isn't.
I think to summarize it in the best way, not to put fear in people, I hope we're not doing that, but to make them understand, educate yourself to the system, because you're going to need it sooner or later. The people that have waivers are waived out economically, but they still have to deal with the same health care system. I don't think they've come to grips with that yet. But learn as much as you can, read as much as you can, read our book. Hopefully you look at our book and see there's a lot of very, very good data. Our book basically protects you from Obamacare. So you should look at it. It has a very good chapter on Romney Care and puts it in perspective what happened around the state in the last few years and the lawsuits that came about. And that's basically it. We need to make each other alert to what is going on, talk to each other, and see what happens down the road. You should be forward looking. Don't look behind.
Now, I agree, and I think that's great advice, Mark, to everybody, because knowledge is power, and part of the problem is this was written in this big convoluted format that the average person would have difficulty wading through and understanding. It's like, what was it, 1,000+ pages?
Yeah, somebody asked me how many pages. Actually, with all the addendums and things, it's over 2,000 pages. But the regulatory structure coming out of HHS, Health and Human Services, will be thousands of pages on top of it. And they asked me what I thought about it. I said, if it's more than 20 pages, it's too long. That's how I feel.
Right. And I also want to encourage people to take right action. I mean, we still have a system in place where you can go to your legislators and say, I don't like this, and I want to know where you stand on this, and what are you going to do about this? I mean, we do need to speak up, and I know a lot of people just aren't sure about our system anymore, but it is the system we have, and I think you should go, and everybody should, if you're not happy with Obamacare or Romney Care, then there are legislators you can contact and let your voice be heard.
I would tell them, if your legislator is for this in government, vote him out. Get rid of him.
That's
I don't care if he's Democrat, Republican. A lot of Democrats, 30 Democrats didn't vote for this.
Really?
They're on record, 30. You have to look at the numbers, 30 Democrats. I think there were many votes on Obamacare. I think the last one in the House was 219 to 212. So a lot of people, The one prior to that, before it got to the House, before it got to the conference committee, was 218 to, I think, was 214. So look at the numbers and see that people
don't want this, and they vote down party line. And I know you're a blue state, but for God's sake, when you need health care and you don't have it, you're going to turn to a conservative very, very quickly.
Yeah.
And I'm no multi-millionaire here selling books or anything to that. I'm telling you the truth. I can prove what I say. It's all in the book, and people should look at it. If you want to get the book cheaper, fine. Amazon usually runs sales. We're on the Nook, we're on the Kindle, we're on the Google Chrome. They were very nice people. Amazon was very good to us. I guess they're conservative people. They put it up there, and they're recommending the book. They put my book on Drudge. You know how much it costs to go on Drudge?
Oh, yeah.
Huge amounts. My book was up on Drudge, and that was nice. And they knew I couldn't afford to go up there, and they put it up there. A lot of people are just coming forward and help you. A lot of radio people like yourself, both terrestrial and otherwise, are coming forward and putting me on, because they know if your book is not rubber stamped by the New York publishers, you don't get into the big stores. You don't get into the airport bookstores. You don't get into
you don't get into the general media, and
if you try to go to Walmart, Walmart should put this book right. Walmart should put this book right up front. They don't do it. They only have a select number of books, and the books are generally not conservative in nature. I went up and looked at what they have. They have only a small selection, but people should know about this book. If anybody from the big pharmaceutical companies wants this book, just call Amazon. They'll ship you thousands of them to put in your stores, because people should read it. It's not a political book. And we try to stay away from politics if we can.
Yeah, I mean, the thing that's great about your book, Mark, also, I just want to tell everybody, is you're speaking our language. I could read this book without a medical degree and understand everything you're saying. It's very clear. It's very straightforward, and it really puts the facts right out there. And again, the name of the book is Obamacare, Dead on Arrival, A Prescription for Disaster, and it is available on Amazon.com. And Mark, thank you so much for coming on the show today.
Thank you for having me, Patricia. I really appreciate it. If you want me back and you want to talk about more,
I definitely do, because I'm sure there's going to be a lot of updates happening, and we definitely want to have you back on the show. And I see there were a lot of questions in the chat room, and I didn't even have a minute to get to them because we had so much to cover and so much more to cover in your next show with us. So, but thank you so much. This is a very important issue. People need to get informed, learn their rights, and also learn, if they don't like it, then take positive action to make a positive change.
Correct. Absolutely. You're right on point. Thank you so much.
Thank you so much, and have a wonderful evening, everybody. We'll be back with you next week. So enjoy your week, stay safe, and get Mark's book, Obamacare, Dead on Arrival, A Prescription for Disaster.
Thanks for listening. Be sure to tune in next week for another terrific episode of Power Preppers with Patricia Baker.